So there's a correlation with the consumption of fructose and the obesity epidemic. We've in around the world, but in the United States in particular, there's an increasing amount of obesity, and some have argued that fructose, the increasing usage of fructose, is associated with that. And it kind of makes sense just from a very high level perspective that if you're putting a lot of nutrient in your body and you can't regulate its utilization, that's going to drive. And we know that when you consume more fructose, that you make more fat. That's definitely happening.
It promotes de novo lipogenesis.
Exactly. It promotes de novo lipogenesis. So we know that's happening. And so it all kind of makes sense. So but you're back to your question about fructose. So we've known for 100 years that cancer cells take up glucose. And the question that's emerged in the last couple decades is, well, what happens with fructose? The discovery about glucose was made 100 years ago, but fructose wasn't in high utilization back then. So what happens now that fructose is being utilized? Do cancer cells, should we be using fructose as an imaging agent?